Did you travel anywhere in the winter vacations this year? I had really wanted to go somewhere, but unfortunately, I was in Delhi. But last year, I did go on a trip and I went to Lithuania, to a lovely city called Vilnius there. And, you know, when you go on holidays, sometimes you have a very planned, packed itinerary, and sometimes in that packed itinerary, something really sudden happens. And it just so happened that I passed a very beautiful church, a very small church, and I entered it and I went inside there. And, we were talking with a priest, a very nice man. And then we were discussing bits of the Bible. And I only remember a lot of the Bible and its preachings and Jesus Christ from a movie called Risen, which had been released in 2016. And I remember it very, very vividly. Um, and the reason I remember that, and then the reason why, I wanted to talk to the priest that day as well, is because it had a scene there where Jesus heals lepers. Jesus goes to that part of society which is at that point untouched, unwanted, and they were shunned and they lived in terrible conditions. And he offered them love. In fact, he put his hand on a leper's cheek, and the love from his hand led to rain falling, and the rain cured them of their disease. And it was just one of those pictorial scenes that has never left me. And so every time I go to a church or I meet a priest, I want to know a little bit more about that particular aspect of the Bible when Jesus met with the lepers. And since then, when I've come back and I realized I know nothing about leprosy in real life today. I know it as something that was written in a book and existed million or thousands of years ago and has been shown into a film, but I know nothing about the situation of leprosy in my own country. This is Sonali Acharji, and you are listening to Health Wealth, a podcast that hopes to leave you feeling better informed about all aspects of well being, but also very motivated to make the right choices, to understand certain health issues better, and to realize your own place in the ecosystem of our health infrastructure. So, today's episode I wanted to do on leprosy, and it just so happened that initially the idea was for me to do a written story for the India Today website, and I spoke to a person, and he started off by just telling me that, just telling me about the burden of leprosy in India, and that shocked me. Because not only did I not know what the situation was, I didn't realize that the situation was that extreme either in this country. And the second part was I also didn't know what caused leprosy. I didn't know how you treat it. I didn't know what the symptoms were. Um, the only image that had sort of stayed in my head was one from a Hollywood film. And I thought that it made a lot of sense. And in a matter of just improving awareness of what goes on in this country for us to do an episode on leprosy and the situation of leprosy patients in India. So I have with me today Dr. Ashok Agarwal. He is the CEO of NLR India and the person who got me interested in this subject. So hello, sir.
Thank you.
Thank you for coming. Thank you so much. I don't want to get into the details before I ask you the most fundamental of things. What is leprosy?
Well, leprosy is both a medical disease as well as it's a disease which affects society a lot. And also, there are some correct terminologies like the word you use, leper.
Mm,
Leper is considered to be a derogatory word.
mm,
And you also quoted scripture, right? But unfortunately, in the scriptures of different religions, it is also written that you are getting this because of some sin,
Mm-hmm.
right?
Curse and sin, yeah.
And this curse is not only going to affect you, but your generations. And that is what we see actually in the field still now. Like we see generations, like grandfather, grandmother had leprosy, but the child suffered, the child got discriminated, and the grandchild also getting discriminated. Even in Delhi, the
Mm-hmm.
capital of India, what we see is that they find it difficult to be friends with schoolmates, right? They hide from their friends where they live. If they come to know that I live in a leprosy colony, then my friends will not be behaving properly with me. Similarly, like for employment, there's a problem. Uh, if the employer comes to know, again, you may lose your job,
Mm-hmm.
right?
Mm-hmm.
And the same goes on. So, leprosy is such a disease which is caused by bacteria,
Mm-hmm.
and this bacteria was discovered around 150 years back, 150,
That's it.
right? Yeah,
Oh, till then we didn't know what caused leprosy.
yeah, yeah.
Ah.
And this bacteria, like many other bacteria, unlike many other bacteria, doesn't grow outside. Meaning, like we cannot do too much of research on this. Like there's no artificial media to grow this bacteria. So that's a limitation for doing a lot of research on leprosy. But the disease which it causes is a bacterial infection, and it primarily affects the skin and the peripheral nerves, meaning like nerves which are around the skin. What a person gets as symptom is skin patches, which are numb, which are little faded or reddish or copperish in color. So that is the commonest symptom. And if that is detected early, then we have medicine which can treat it. There is a medicine called multi drug therapy. It's commonly called MDT, and it is supplied free of cost by the government of India. And not only government of India, but almost all countries. So, which can kill the bacteria. Even a single dose of the drug can kill more than 90% of the bacteria, meaning the person becomes non transmissible, like it
Mm-hmm.
doesn't, the disease doesn't get transferred to him.
Mm-hmm.
And also, we are blessed that there is also a preventive therapy. Uh, in fact, in India, it was NLR India which had conducted the feasibility study along with Government of India in Dadra Nagar Haveli way back in 2015.
Mm-hmm.
And excited with the results, Government of India, they launched it as a national program on 2nd October 2018. Now, that drug is quite effective. It is effective to the extent of preventing 57% of the transmission. But then, the challenge is that the the new cases need to be detected early, treated early. The contacts should be screened early. And then eligible contacts need to be administered the single dose rifampicin preventive medicine. And though it is only 150 years old, it happens to be one of the oldest bacterial disease known to the mankind. And though we did not know about the bacteria, but then the symptoms and signs of leprosy uh, have a history of thousands of years.
Mm-hmm.
Like in India itself, we have found out of skeleton around 4,000 years old, and it's from
Mm-hmm.
Balathai, and which means that there was leprosy in those times
Mm-hmm.
also,
Mm-hmm.
right? And somehow, uh, since there was no treatment available, so people tried different things.
Mm-hmm.
Like you also mentioned about Jesus. So there were also many such people
Mm-hmm.
who tried to cure it, and a lot of myths took birth,
Yeah. Yeah.
right?
Because bacteria are really smart, no? I mean, they survive through millions and millions of years and various conditions. And um, tell me, is the bacteria which causes leprosy, is it like, for example, when you get TB, it can stay in your body for a very long time and then cause the symptoms. Does that also happen with leprosy? Is there a gap?
Yeah. In fact, this is called incubation period,
Mm-hmm.
meaning like the time period between entry of an organism till the point of causing symptoms
Mm-hmm.
and sign.
Hmm.
So the incubation period for leprosy is quite long. It's longer than tuberculosis. So it
Okay.
varies from 2 to 5 years. But in some cases, it may stretch up to 10 years, 15 years, 20 years.
So you could be
Right?
living with it, but you don't know.
Yeah, yeah. So,
Is there any way to test for it when it's in its incubation period?
unfortunately, leprosy became a neglected tropical disease. Why? Though it was like uh, the place where the bacteria was discovered is Norway, right? So during those times, Norway had a lot of cases of leprosy, and there was a lot of research made, right? But Norway was also able to, the European countries were also able to quickly control leprosy. During those days, there was no medicine available. But, steps like a good nutrition, good hygiene, less overcrowding, these are the three predisposing factors. So, because of this, and the economic growth, right, uh, and the increase in uh, immunity, right, so that helped
Mm.
actually get rid of leprosy during those times, right?
Yeah.
But unfortunately, in our countries, like Asian countries, African countries, where the living standard is very poor, and it's a disease of poverty.
Mm.
Most of the affected persons are very, very poor,
Mm.
very marginalized. If you think of most marginalized sections of the society, it is the persons affected by leprosy. And so, which also means that they are not able to voice,
Yeah.
they are not able to voice their needs. So, because of all this, the research for leprosy also took a beating. And also, what happened, around in 2005, actually, uh, globally, WHO, they declared that, and especially in India, they declared that leprosy has been eliminated at the national level.
Okay.
But, what was not told is that still we need to eliminate leprosy at sub-national level, meaning at the national level we may have
Mm-hmm.
got a particular ratio,
Yeah.
which is like less than one case per
Mm-hmm.
10,000 population. But that has not happened in many states and districts, right? So that message did not go.
Mm-hmm.
No one
Mm-hmm.
saw that message. Even people like me who are doctors,
Mm-hmm.
when we heard that leprosy has been eliminated, we thought it eliminated,
Yeah. Yeah.
right?
Yeah.
And the layperson definitely will feel that, okay, there is no more leprosy.
Mm-hmm.
But then it has not happened that way.
Yeah.
We are still getting around 100,000, 1 lakh new cases every year
In India.
in India.
Is that
Uh,
the most globally in terms of
yeah,
proportion
yeah. And which accounts for almost 50%, sometimes up to 60% of
of
the
the
global
global?
new infections they occur in
Yeah.
India.
Yeah. This was the first thing
Y-
you said to
Yeah,
me that
yeah,
shocked me,
yeah, yeah,
that I had
yeah,
no idea about
yeah,
this.
yeah. And at the time of detection of new cases, uh, almost 5% already have a disability, invisible or visible
Mm-hmm.
disability. Visible disability is the severe type of disability.
Mm-hmm.
So they are detected with some kind of disability, right? So this also indicates that these people have been detected late.
Mm-hmm.
That is why they develop disability.
Yeah.
And almost 5% are children, right? Now, uh, and getting infection children means recent transmission is happening.
Mhm. Right.
Yeah.
And so just a couple of things, because I know that when even people from a slightly higher economic background, when they develop anything on their skin, even a white patch, there is a lot of hush hushness about it. I do know a friend's mom who had an experience like this, and she just didn't want to discuss it. There was this constant fear that, okay, what if it's leprosy and so on, and she didn't even want to go in for a test. Um, so, couple of things that I'm curious to know. One is, how do you diagnose it? And two, how do you sort of overcome this hesitation of diagnosing also, no? Because you feel so scared to be told that you're going to get a disease that you know nothing about and that is heavily ostracized. How do you sort of get to a situation where diagnosis becomes easier?
Yeah. So as I was mentioning that it became a neglected disease, right? And there wasn't much research, right?
Hmm.
So the diagnosis actually remains clinical. Clinical meaning based on signs and symptoms.
Okay, there's no
So,
test, no blood test.
well, there is a test, but then it is not very specific. There is a test called smear test, slit skin smear test, right? And nowadays, some PCR based tests are also getting developed,
That's
right?
good, actually.
Yeah,
Yeah.
but still, if we say gold standard
Hmm.
test is like you see under the lens,
Hmm.
right? And that is slit skin smear test. But in case of leprosy, even if it is negative, right? Even if you are not able to see a bacteria, even then someone may have leprosy because the concentration is so low, right, that it is not detected, right? So actually, leprosy diagnosis is little tricky
Hmm.
as compared to tuberculosis. So it's always good that we go first by clinically, right? In fact, there is a program which tries to identify leprosy early. Uh, it's called Leprosy Case Detection Campaign, right? Wherein the government of India every year, sometimes once, sometimes twice a year, in select places, they do this campaign, and where all ashas they are oriented. They already know, but
Hmm.
the fresher training is done for signs and symptoms, what all things they should look for,
Hmm.
right? And accordingly, these ashas they go home to home, and then they detect the cases. What they do is they suspect cases, right? And then those cases are referred to the nearest health facility, which in rural areas happens to be the primary health center. And there, then the
Oh,
doctor.
it can be diagnosed at a PHC level as well.
Yeah, yeah, yeah. In fact, most of the diagnosis happens at the
That's
PSC
good. At least you don't
at
have to
PSC
go all
level.
the way to a
Yeah,
larger
yeah.
center.
So only difficult cases, there, the test is
Hmm.
applied
Yeah.
to reconfirm, right? But otherwise, most of the diagnosis is clinical.
I,
Mm.
I like that approach of using community workers to
Mm,
sort of
mm,
get people to the nearest health center.
mm.
I've heard about it in many health programs as quite effective.
Yeah. Uh, Again, the challenge for leprosy diagnosis is ashas are engaged, right? But uh, the lesions, I mean, the skin patches, they need to be seen properly. By that, I mean that a female examining a female because the patch may be on your back or maybe on your buttock,
Mhm.
right? So, someone needs to get inside the house, find the privacy, right? And examine, right? Which occasionally doesn't happen. And that is where the cases are missed,
Mm.
right? So that's a big challenge. So, there comes community awareness,
Mhm.
meaning like we have to, like today, the show which we are doing is part of community awareness.
Mhm.
And I'm very thankful to India Today that India Today has taken this proactive step, right? And so more and more people, they should come to know that leprosy is not a disease you should be scared of because it doesn't spread easily. More than 90% of us are immune to leprosy
Because of our health
because
and.
of health, because of like we take vaccine,
Mm-hmm.
BCG vaccine, that
Mm-hmm.
also provides immunity to some
Mm-hmm.
extent. So more than 90% of us are already immune, right? And then If our health is fine, our nutrition is fine, right? Then we don't need to worry about it. And and even if someone gets, the treatment is available. And there is not much drug resistance. Like in
Mhm.
tuberculosis, we hear
Yeah,
a
it's
lot
very
of drug
high.
resistance happening.
Mhm.
There is no drug resistance, very small amount of drug resistance, right?
Is
And
the
then,
treatment
yeah.
like TB again? Is it that extreme, that expensive?
No, it is not expensive. It is
Okay,
not
but
expensive, and
difficult?
it is easily available, freely available from the Government of India program. And but then it needs to be taken for 6 months to 12 months.
Mm.
There are primarily two types of leprosy. One is possibacillary, meaning less bacteria in it, and one is multibacillary, is more bacteria in it. So in the multibacillary, you need to take it for 12 months.
And it's one medicine or
Hmm?
multi? It's multi drugs, right? So.
Yeah, multi-drugs. So there
Mm.
are three drugs,
Mm.
but then they come as a strip, one single strip. So
Mhm.
three types of medicines in one
Okay,
strip. Yeah,
that's still
yeah,
convenient then.
yeah, yeah.
Um, Tell me, if I don't take treatment and I don't do a diagnosis, how bad can leprosy get?
Right. So here, this is what happens with many, many people, right? Like I, uh, even if I know, right, that I have something, right?
Mhm.
Like you said, white patch, and people don't hush hush starts. Same thing happens, right? So I have some suspicion, right? And I'm scared about sharing with my family because I don't know how they will react, right? Because there have been instances I know where people who have this, they have been thrown out of home, right? And then I'm scared to even disclose with my friends, right? Uh, so I'm within myself, right? And I actually don't know where to go. So imagine someone in rural pocket, right? Uh, with less health facility, right? And with low literacy, low resources, right? The person just keeps suffering, right? And gradually, what may happen is that the person may get disability. And the disability may be why? One is, I lose like numbness. Numbness comes, right? So I am not able to feel if it is hot, if this
Mm.
cup is hot, right? Or if I am cooking, I burn myself, I don't feel it,
Mm.
right? If I am walking, right, I injure my foot, I don't feel it, right? Then what happens? You get uh, an ulcer, right? And I don't care about that ulcer, right?
Because you
The
can't feel
ulcer
it.
becomes
Mm.
larger. Sometimes the ulcer can become so bad that it starts oozing and it smells from a distance, right? And the extreme thing is maggots. Maggots also come, right? All those kind of things may
Mm-hmm.
happen,
Mm-hmm.
right?
Yeah.
So I then am unable to walk properly, right? Gradually, what happens is my I lose strength, like strength in my hands, right? In my leg, my limbs can become crooked, clawed hand, right?
Mm-hmm.
Similarly, foot drop can occur, right? It also may affect my eyes. I'm unable to close my eyelids, right? So if I am not able to close my eyelids, my eyes will also get damaged, right? So many things might happen,
Yeah.
right?
Yeah.
And gradually, the fingers, the it will affect the bones. They will get smaller, right? So and I will get a very terrible looking disfigurement,
Yes.
and no one will like to look at me, right? All this might happen. Plus, I am a parent, right? And the others in the society, they come to know that his father is like this, right? They keep distance from my children, right? Like I have met a number of people, who had disability, but now they are fine, cured. Okay, the infection is not there. Disability is also managed,
So,
right?
so it can be cured even at that late stage?
By cure, I mean is infection can be cured,
The infection can,
meaning
not the
the bacteria.
disability.
Bacteria can be
Mm-hmm.
killed. But the disability,
That stays.
but even the disability can be managed.
Mm.
there is something called self-care. In
Mm-hmm.
fact, NLR India has done quite a bit of work
Mm-hmm.
in its last 25 years
Mm-hmm.
where uh, four different models of disability care have
Mm-hmm.
evolved over a period of time, right?
Mm-hmm.
We have a model of self-care which works at leprosy colonies.
Mm-hmm.
We have a model which works at primary health center. We have a model where we combine leprosy with the lymphatic filariasis.
Mm-hmm.
We also have a model at home-based care in West Bengal.
Mm-hmm.
So all these models have been along with the government,
Mm-hmm.
and we have evaluated all these models, and they have demonstrated their own values,
Yeah.
right? So through these models, through self-care, we have seen that claw hand
Mm-hmm.
gradually straightens out, right? Sometimes, a surgery can also be done. It's
Mm-hmm.
called reconstructive surgery.
Mm-hmm.
But then, it needs to be again screened properly where your joint is still mobile so
Mm-hmm.
that reconstructive surgery can happen.
Mm-hmm.
So there are a lot of means.
Yeah.
But, uh, the one is the kind of stigma discrimination which is there in the community that should go down
Mm-hmm.
so that I can start feeling comfortable, access service. Uh, so, and
Mm-hmm.
participation of the affected person is very, very important.
Right. Right. I'm very glad you said a bit about access to services because that is something I'm also again in the dark about the life of a leprosy patient in this country. So if I ask you about various things, can you just tell me what the situation might be like? So when it comes to accessing healthcare, um, what would their life be like?
Well, there are both kinds of situations.
Mm-hmm.
Places where things have changed, meaning like where some community program has been going on for quite some time, right? Uh, like we have a district called Aurangabad, where we have been doing a community based disability inclusive development initiative since 2016,
Mm-hmm.
where the entire district, has become so aware that a person affected by leprosy, openly reveals his or her status, right? And there is no stigma discrimination, right? So such situations are there. Now, in case of such situations,
Mm-hmm.
the access to health service is not very difficult. Yeah,
Mm-hmm.
the person is connected to Asha. Asha connects to the doctor, right? Doctor is also sensitized. The healthcare providers are also sensitized. The people waiting in the waiting room, they are also sensitized. I don't feel uncomfortable,
Mm-hmm.
right? I get my treatment. But, you know, in most of the situations, this is not the picture. The field workers, frontline workers are there, right? The doctors are there, right? Medicine supply is there. But, I am feeling hesitated to go and access that service,
Yeah.
right? And this stigma discrimination, we
Mm-hmm.
are particularly recently we are doing a study on how to make uh, the healthcare providers more compassionate towards persons affected with leprosy.
Mm-hmm.
What we have found out is that even if I am a doctor and I know about how leprosy spreads, the medicines which are available, how it can be treated, and then how it can be prevented. Even then, the my own conditioning over the years in the society, what I've seen in the society, I've seen that my parents, right, or elders or neighbors, right, we have been seeing persons affected by leprosy with disability and begging at religious places. So what people do, right? People just throw a coin, right? Just throw a coin,
Mm-hmm.
right? That is the kind of attitude we
Mm-hmm.
demonstrate towards them,
Mm-hmm.
right? So we are giving some alms, right? That is the way we treat, right? So, so which means that there is an expression of some kind of maintaining a
Yeah.
distance, right? You don't go and hug someone, right?
Mm-hmm.
You don't go and marry someone, right? So, which means the community has been conditioned, right, to
Mm-hmm.
keep a distance
Mm-hmm.
from the persons affected by leprosy. So, the same thing happens to a healthcare provider,
Mm-hmm.
right?
Mm-hmm.
Even if the person knows everything, but still, since because of that conditioning, right,
Mm-hmm.
the person behaves in a different way.
Yeah.
And even if the healthcare provider is not behaving that way, the persons who are waiting along with the person in the waiting room, they behave that way, right? So which means that my access becomes difficult,
It
right?
and you mentioned married.
Mhm.
Um, what if somebody is married already and
Mhm.
then they get leprosy?
Yeah.
How does that affect their life?
So I will uh, relate one interesting case here. I mean, real story, right? And this story I have collected from one of our very senior community-based rehabilitation coordinator, right? So what and this has become his most memorable story, which he feels very bad about it. He cannot forget, right? So around 15 years back, he met a 30 years old person, right? And he had a severe ulcer, the kind of ulcer which I described with maggots,
Mm.
right? And he was staying beside a pond, right? As he was thrown away from the family after they got to know about it. Even his wife, she deserted him, right? So he was totally devastated and just sitting there. So our staff, uh, he, along with our doctor, we started caring for him, right?
Mhm.
And gradually, over 2 3 months, there were signs of improvement, like the maggots were gone, right? But suddenly, one fine day, when our staff goes there, he doesn't find him anymore, right? And then he checked with other people. No one knew where he went. So till now, it has been, say, almost 15 years.
You don't know where he is.
We don't know where he is, right?
Mm.
Now, what could have happened to him? He could have ran away somewhere, right?
Mhm.
He doesn't want to be seen. But wherever he goes, his ulcer will be there, right? His condition will be there, right? He may have committed suicide. We don't know, right? Okay. So anything
And there's
may
no
happen.
one out there looking for him
And
either.
there is no one
Was
who is looking for
yeah,
him,
yeah.
right?
Tell me about younger
Hmm.
patients of leprosy. What happens to their education and their sort of professional career? Because as children or even as a young adult, that's the life we have. You study and then you get employed. But you get hit with leprosy, then what happens to you?
Right. So again, we have both the kinds of stories, right? Places where people have
Mm-hmm.
expressed a lot of resilience
Mm-hmm.
and they have settled themselves, right? So let me give you a story where
Mm-hmm.
uh, which demonstrates the kind of resilience a person expresses. Again, around I think a 25-year-old male, right? Uh, uh, he came into contact with one of our staff in the field, right? And his hand was bent, right? And he was not able to do any work, right? And he was crying. He also had a family. He didn't know how to earn livelihood, right? So again, our staff, they started caring for him, taught him self-care, right? And over a period of 2 years, right, his hand became straight, right? Then we supported him to open a small shop of puja items, right? So with that small loan, he was able to also make money and he paid back, right? And later, with his own money, he he opened a plant for purifying water,
Mm-hmm.
water treatment plant, right? And now, after around 10 years, he is not only supporting himself, but he is also employed five other people, other persons with disabilities, right?
Yeah.
And though their lives have also been changed. And, his children, one of his sons, only 3 days back, we got the news
Mm.
that he got selected in Assam Rifles, right?
Incredible.
So this is a story where like things started with a very difficult situation, stigma, discrimination, no support, etc. And this man was broken,
Yeah.
right? But then he came out, right? and then he changed his life
Yeah.
with some small support, right?
But that support is so important.
Yeah.
And I remember this story. It's really funny. I was living in Bangalore for a little while.
Mm-hmm.
And I had a house help, and she came one day and she said, "Can you lend me 10,000 rupees?" And I said, "Well, sure," because I mean, my house help are just an extension of my family. So I said, "I'll give it to you, but what do you need it for?" And she said, "I want to move to this locality. I don't want to live here anymore, and the rent is 4 times more." And I was wondering, I said, that locality is right next door. It's like barely 500 meters away. So why should the rent be that much more? So I asked her, I said, "Why is it so high?" And she said, "There's an amazing organization there. So there are like certain slum areas or certain communities where if there is intervention by any NGO or organization, then they'll charge you a premium to live there because
Mm-hmm.
you're going to get that, coveted support."
Mm-hmm.
Which is why, when you hear things like this and you realize how much this support means for people,
Yes.
that without it,
Yeah.
there's not much.
Right.
So tell me, how does an NLR India work? I mean, what sort of support are you giving, and how can I, as an individual, contribute or volunteer, and what can we do? We're listening to you talk, but tell us now, what can we do?
That's an excellent question. And actually, that is also allowing me to express how this kind of work can be continued,
Mhm.
right?
Because
Because,
I think without this sort of
yeah,
intervention, it's
yeah,
difficult.
yeah. Uh, because, still there are 100,000 new cases. But, uh, the positive things about leprosy or what has happened, let
Mhm,
me just spend a few minutes there.
mhm,
When there was no MDT, like
mhm,
MDT came in 1983, right? So before that, they used to be around more than 400,000, 4 lakh new cases every year in India, right? And after the MDT started, meaning the cure,
mhm,
right, the number of new cases have come down drastically, like 4 lakhs to 100,000 now. Also, in the interim, the development was of the preventive medicine, single dose rifampicin, which came in 2018,
mhm,
right? So, all these had very good effect on the management of leprosy, in spite of all other issues, right? So now, actually, if we join hands, we can win over leprosy. That is the kind of situation. In fact, with Government of India in 2023, we together worked and have developed a national strategic plan for leprosy, for eliminating leprosy. And actually, that's a very ambitious plan that by 2027, the number of new cases will be reduced by 50%, meaning from 100,000 to
mhm,
50,000, right? But then, even if we are not able to achieve the targets, but, things are set in motion, meaning a direction has come, right? And NLR is heavily engaged actually, NLR works with government, very closely with government. And NLR India is recognized as one of the most trusted partners of the government, of the Central
mhm,
Leprosy Department. In fact, in April this year, we completed 25 years. And during that celebration, uh, two very senior officials came. One from the Public Health Department, is a senior health advisor, National Center for Disease Control. And then also came Bharat Lal. Bharat Lal, he's Secretary General, National Human Rights Commission. So he was also very influenced with the kind of work which
mhm.
NLR India does. And he commented that you guys are doing marvelous work, a meaningful work. And later, within 2-3 months, NHRC has created a special position called National Special Monitor for Leprosy for the first time.
Mm.
And one of our staff is serving as the special monitor. So, and our presence, NLR India has selected 8 states, and these 8 states, they account for almost 50% of the uh, leprosy burden in the
Which
country.
has the most? Which state, if I may ask?
So the the state with highest number of infection is
Mm-hmm.
Maharashtra, and then
Mm.
Chhattisgarh, right? Jharkhand, Bihar, Uttar
Okay.
Pradesh. So these are the states,
Yeah.
right? So we are present in 8 states, and
Mm-hmm.
these states account for around 50% of the
Mm-hmm.
Indian leprosy load. We have strategically selected that we place ourselves in such states and districts
Mm-hmm.
where we can bring a tangible change to the whole burden of leprosy. So, as I was saying, that we have developed different kinds of models. That is the way we do that.
Mm-hmm.
We model something, pilot something, create evidence, right? So, we have developed 4 different types of disability care models. We have developed a disability inclusive development model. We have developed the very first helpline on leprosy, which is considered to be as a best practice
Mm-hmm.
by Government of India, and they want it to be scaled up nationally. But what prevents is that we are looking for resources, right? So the opportunity is immense. The opportunity is that if there are corporates who are listening to this program, right, and if they get motivated, which they are, because India has a very large-hearted corporates and who are helping out a lot of programs. Only thing is they need to understand leprosy and possibly get tuned towards leprosy. So if they can adopt, say there are 200 districts in the country which are high burden, right? Out of around 800 districts, right? So these districts can be adopted by them. And we have the know how and we have the relationship with the government to make it happen. We have the relationship with WHO, with the APAL. APAL is Association of Persons Affected by Leprosy. So along with all of them, we can actually help in taking responsibility to the districts. We can do early case detection
Mm-hmm.
there, early treatment, everything. We have a huge experience of GIS mapping and how to
Mm-hmm.
use GIS mapping for controlling leprosy.
Mm.
So all those things can
And and
happen,
and
right?
can individuals also
Yes,
contribute?
yes. So the easiest way which uh, anyone can contribute is like get aware of leprosy, right? And then convey the right knowledge
Mm.
to others, right? Do not discriminate anyone, right? You can also be a volunteer, connect with agencies like NLR India.
Mm-hmm.
You can be a volunteer. You can mentor children, right? Uh, then you can also contribute
Mm-hmm.
financially.
Right.
And there's a very easy way. No donation is small. It can start from rupee 1 to any amount,
Mm-hmm.
right? You can become one time or regular. All those things
Mm-hmm.
are open.
Right.
Plus, like you can also support a project if you
Mm-hmm.
want, right?
Yeah.
So there are different ways an
Mm-hmm.
individual
Mm.
can. So even if not financial uh, or non-financial support, that is also welcome.
Yeah. Yeah. No, I think awareness is so important. Um, I'm going to come to. We're nearing the end, but there are just two things I was very curious. You are a doctor by training, and as you said, you worked with HIV, and then you switched over to leprosy. You know, before this recording, I did go through some visuals of leprosy patients. I was trying to sort of understand and imagine and be very honest with my own reaction to somebody who looks so different from me. And it was not easy. If you ask me if I'm left alone in a room, um, it takes a while to not see the physical appearance and remember there's a human being behind that, whatever the physical deformity might be. Um, the reason I'm asking you this is because you've switched from, you've really seen patients at their worst. And how do you deal with it? How do you um, look at someone who might just be something you've never seen before and not be, something you're comfortable or familiar with? And how do you um, not have a reaction that might be painful towards them or hurt them in any way?
This is an excellent question. And this actually reminds me of Baba Amte. Baba Amte,
Mm-hmm.
you may, for the audience benefit, he was a disciple of Mahatma Gandhi ji. And he came from a wealthy family. was a lawyer, but then he had a motivation to work for leprosy, right? And what motivated him is, uh, he was going during those days. There were a lot of forests, so he was walking through a forest, and then he saw someone who was lying on the floor, right, in the forest alone, right, and looking uh, very bad, disfigured totally, right, smelling, etc., right. And there was no one who was looking at him. I mean, there was no one actually in the
Mm-hmm.
forest at the mid of night, right. So he stopped there, but then when he saw, got scared. So he walked away, right? And then later on, he came back. He came back and then he carried that person to his home, right? That person ultimately did not live, but then he cared for him during his last few days, right? But the learning of Baba Amte, the statement what he has made is that to care for leprosy, you have to overcome your own fear,
Your
right?
own
Yeah,
limitations.
your
Yeah.
own fear that you have to overcome, right? So during those days, there was no medicine, right? But now you don't have that kind of fear. Now, since you mentioned about HIV, and I have
Mm-hmm.
worked so much on
Mm-hmm.
HIV, actually, during the early days when there was no ART,
Mm-hmm.
antiretroviral therapy for HIV, right? People used to end up in being in bed for months together, right? Unable to turn side, totally dependent on others, right? And die, right? Called AIDS. And during those periods, there was similar kind of stigma and discrimination towards HIV infected. But nowadays, with the modern medicines, right?
There was so much
People
of
people don't
awareness.
go into that stage, right? So it
Mm.
is not visible.
Mm.
And the other big difference is that HIV happens across all strata of society.
Mm.
But this is a poor man's disease and it is visible, right? And that visibility brings all the stigma and discrimination.
Yeah, I agree.
If it was hidden, then no one would have bothered because then I'm sitting next to you, you won't know I have leprosy,
Mm. It's the
right?
same with TB, I
Yeah,
mean,
yeah,
until and unless you
yeah,
disclosed you had TB,
yeah, yeah,
you
yeah.
could, and people were scared to disclose that they had TB because of
Uh,
the persecution.
uh,
But thankfully, TB and AIDS seems to be doing much better in terms of
uh,
awareness.
uh,
Hopefully, leprosy will also get there.
but tuberculosis is far more infective.
Mm.
You get the infection far more quickly,
Mm-hmm.
right?
Mm-hmm.
And second is that it can really cause damage to your lungs
Mm.
and different other parts of the body,
Mm-hmm.
right? It can also cause death. Leprosy doesn't cause death, but
Just.
then the life becomes miserable,
Mm.
right? Which often, at least I feel that often it becomes more miserable than living. Yeah, than dying
I,
rather.
I, I
Yeah.
just have one last question, which is not really leprosy related, but just the state of the world. Um, I understand that we have compassion and kindness, and we have apathy and ignorance on the other hand. And just the state of things today, wherever you look, there's a problem, whether it's on a micro level or a macro level. Sometimes um, the problem seems so much that you really wonder, like, why do I need to care at all? I mean, is it leprosy I should care about or TB? I mean, just on this podcast alone, we've discussed, I don't know how many diseases, from a rare disease to, cancer patients. And there have been so many problems after problems. And it gets overwhelming. And sometimes you just want to turn a blind eye. It's better. Let me just focus on myself. Why do you think it's important for us as human beings to still invest in being compassionate and kind, no matter how many problems there are, and still find our path towards contributing to something? It doesn't have to be, necessarily the world's biggest problems, but certainly, find that in us to be a part of something that will make the world better.
So now, first, let me explain what compassion is, and now why I can explain it better because currently we are engaged in a research along with the Emory University Leprosy Research Initiative. So we are doing high-level research on compassion. So, what compassion is? Compassion, a compassionate action, is helping another, especially in response to an observed need, such as seeing someone in trouble, in pain, or otherwise suffering. So it's not talking of any disease, right? It's just a reaction of helping someone in need, right? Which actually should be the character of human being.
Mm.
And not only human being, even an animal does that, right? Like I have seen someone in a pond and a dog shouting, right? Trying to draw attention, right? A stray dog,
Mm-hmm.
right? So that is an inbuilt thing, and we should be doing it. And I'm very happy again to relate an incident, my personal incident, and through which I think feel that we are still very, very compassionate. Its only thing is focusing and
Mm-hmm.
doing things at the right time. What happened with me was uh, around 6 months back during my morning walk in some district of West Bengal, the place you come from. Right?
Mm-hmm.
You are not born and brought up there. I'm born and brought
Well,
up there,
I
right?
have I have genes from there,
Okay.
both in my blood and on me.
Okay. Okay. So I
Yes.
had gone to a district called Mushidabad, right?
Mm-hmm.
And every morning I go out for a walk. That day also I went for a walk and I found a lovely lake, right? And I was taking a round of it. And at one end of the lake, I found that there is no proper road to go. But then what I found is a muddy patch, right? And which to me looked like that is quite stable. And I then started walking onto it.
Mm-hmm.
So I may have gone around, say, 4 or 5 meters. Gradually, it started becoming loose. Yeah. And I was like going inside, right? And I just did not know what to do, right?
Mm-hmm.
But what I found is that around 20 meters away, there were some youth who were fishing.
Mm-hmm.
They saw me, right? And they then made a human chain, right? And pulled me out.
Yeah.
Now, I was a complete stranger for them, right? No one, right? And they just responded to that situation, right? So,
Okay.
this is being compassionate,
Mm-hmm.
right? Now, in my incident, there was a risk involved. There was a risk involved. But in leprosy, there's no risk involved. If I go out and help a person affected by leprosy, I don't have any risk.
Mm. You have a lot to gain also
Yeah,
because not only are you getting out of the house and meeting different
yeah,
people,
yeah,
it's better than sitting at home and
yeah,
watching OTT.
yeah. And also then be
Yeah,
part of a movement where you can end leprosy,
and
right?
feel yeah. Thank you so much. I mean, I think I've certainly learned a lot today, and that awareness helps. You're right. Thank you.
So pleasure talking to you.
Thank you.
Thank you.
You know, one of my things with empathy or compassion or kindness is that over time you start to realize that not everyone will appreciate it and not everyone will give you back what you're giving. And I used to have a huge problem with this. In fact, I know a lot of people who do. And we call ourselves realists. We're not romanticists. We don't believe in karam and that, what goes around comes around. We're real. We have done this for you and you have taken advantage of us and we don't want to do anything anymore. We'll find someone else. Um, and that was a philosophy me and a lot of my friends did follow for a very long time. And after a point, you start to realize that it makes relationships and everything you do in life so transactional. And a part of you starts to change. It's not just in your interactions with others, but also in, when you go to get a cup of coffee. If it's a little less, then you start wondering, oh, I paid for a full coffee. Why did you, lower the amount? And it's annoying. And so I actively worked on myself. I still think I'm a realist, and I wouldn't like to blindly do too much. But certainly, I've stopped looking at gains, and it's more like I will do to the point that I can do, And beyond that, whether you use that help or you choose to reciprocate or you choose not to, that's your life journey. And that brings a lot of peace and a dimension to my personality now, which I'm quite happy about. How do you view compassion? And did you learn something that has added meaning and a different perspective to your life? I'd really like to know your thoughts. You can write to us at pods@indiatoday.com, or you can message us on 8588966996. And we are available on Apple, YouTube Music, Spotify, the India Today website, and many, many audio streaming platforms. So if you've enjoyed this episode, please leave us a rating.